So now for the next stuff which we'll get to discuss, this is what is known as glycemic control. So glycemic control just simply means you're actually trying to keep your glucose levels in the body within what range. Alright, so glycemic control is what we're talking about next. So it just simply refers to how well a person with diabetes maintains their blood sugar levels within a target range, of course. So good control, of course, we should reduce what any risks of all those complications of high glucose levels, so high sugar levels being deposited in what tissues or organs, causing issues. So what glycemic control means is the ability to keep the glucose levels close to normal. So it should be between what 70 to 130 milligrams per dl before meals. Then even after you eat, your glucose level should be between what less than 180. Okay, so how do you measure to ensure that what the glucose control is adequate? So you do all those hemoglobin A1AC test. Okay, then also you can actually teach the patient how to use some one or two simple devices in order for them to actually what track their glucose levels. So goal is you're actually doing all of this because you want to prevent hyperglycemia or hypoglycemia. Okay, so how to achieve these glycemic control levels is they have to actually advise you on what you are eating. All right, so you have to eat more of high fiber, you have to eat more fruits, you have to eat more vegetables, you have to reduce the way you take carbohydrates. Okay, so regular physical exercise to improve the way your cells are actually responding to insulin, weight management to reduce insulin resistance. So medications, you give all those drugs like type 1 for type 1 diabetes that the person is lacking insulin, you have to replace their insulin. Type 2, you give all those oral agents, Lispro, Aspart, metformin. All right, then keep regularly measuring the glucose levels, right? So this is what it actually means by glycemic control.